Welcome back to another episode of Spilling the Tea with Dr. T.
And Gabriel D.
That's me.
And Lava Lee. Welcome back to another episode where today we're going to be discussing something that we've touched on a little bit in the past.
Yeah.
But it's really about understanding whether or not you're experiencing weak erections. So the topic is, are my erections weak?
Great topic. Very interesting. I have a lot of questions for you today. And I'm excited.
Yeah.
As always.
This topic is super important because not only do erections impact our sexual satisfaction, but our way of life and our overall happiness.
Yes.
And so we're going to discuss things that influence erections, how to diagnose if you're having weak erections, and then how to improve them if you're concerned or looking to, level it up a little bit.
Spice things up. I like that.
And for those out there who are concerned about their erections already, discuss it with your primary care doctor. That's what they're there for. They can get you appropriately screened and consider having your hormones tested. If you don't have a primary care provider, we're going to put a link in the description of this video where you can reach out to us at hendrxhealth. We'll set up a consultation to discuss your concerns, get some labs ordered. And actually this summer, we're doing a special. We're doing an essential biomarker assessment. Over 18 labs are going to be tested for $150. And so if you're interested in that, again, that link will be in the description of the video. Would love to meet you and get you tested to see if hormonal problems could be contributing to a weak erection or maybe low testosterone.
That's a great deal.
Yeah, we try.
And so what is a weak erection?
So erection strength refers to the firmness and sustainability of an erection throughout sexual activity or intercourse. It can vary greatly among individuals, and it can vary depending on multiple factors, both psychological and physical. And in general, it's really important to understand how your body's responding normally to sexual activity, so you're able to track that progress and ensure you're on top of your sexual health and sexual history.
Firm and sustained erections for all.
Absolutely.
So technically, a good erection is a firm and sustainable erection for penetration.
That's right. So if you're able to penetrate without problem and you feel as though it's as firm as it should be, you got nothing to worry about.
Is there a way to check our own erection strength?
Absolutely. A self-assessment can be done through physical sensations, monitoring your firmness, as well as monitoring how long your erection lasts. And if this is changing or if it's of concern to you, it's a great topic to talk to your doctor or to consider further investigation on what could be going on. Then there are tools like the erection hardness score that are going to provide more of an objective way of determining the strength of your erections. They're going to have a scale 1 to 4. A lower score is going to indicate that you're having trouble with your erection. Maybe it's getting bigger, but not hard enough for penetration. And then a higher score is going to be, it's fully firm, enough for penetration, and, basically a 10 out of 10, so to speak.
And where can I find the score?
You can actually Google it. So it's right there available to you. You'll answer some questions and it'll use a calculator adding up the scores to determine if your erection's more on the weak side or firm.
Easy.
Yeah, and so if you're noticing that your erections do represent your genitalia getting larger but not firm, this again is going to be more of a sign that you're having weaker erections, and improvement could be there to help you have a more satisfying sexual experience.
Absolutely.
Oftentimes, those that are scoring on the lower side or having weaker erections are going to be most vulnerable when they're changing position sexually. So maybe something stressful happens, or they move in an incorrect position or a position that is less stimulating for the genitalia, and that's when they're going to lose their erection. So that could be another sign that you're experiencing more weak erections than previously.
And so what are some factors that affect erection strength?
There are multiple factors that can affect or impact our erections. We're going to think mental health concerns like stress and anxiety. We're going to think hormonal changes, testosterone being the most important hormone to provide us a sustainable and satisfying erection. We also think of age, because as we age, our hormones likely change and can decrease. And then, of course, we want to consider chronic medical conditions that can impact the blood flow to the genitalia, those nerves that are receiving the sensations. And so those are the main issues that can be impacting our erectile function.
So there are multiple factors at play.
Exactly.
How about mental changes? How do they impact our erections?
So anxiety, stress, and mental health changes are going to have a negative impact on the strength of our erections. And the main reason is because whenever we are under stress, there's the release of these hormones that actually combat our ability to relax and to perform sexually. So those are going to make a dramatic impact on how you can function. The most important thing we're going to see in regards to how it's going to affect our erections is something called performance anxiety. So you're in the heat of the moment, you start getting stressed or anxious, those chemicals sort of take over and can lead to a less satisfying sexual experience and problems in the relationship as well.
It's interesting. Sometimes you think that you're having something happening physically to you,
Right.
but it's all here. It's all
Exactly.
in your head.
Right. Just like you mentioned, things start in the head and then your body starts to respond with those release of chemicals and
Right.
hormones that are going to impact our sexual wellness.
Right. And speaking of hormones, how do hormones impact our erections?
So, in contrast to those hormones that are released during anxiety and stress that are going to reduce erections, testosterone, which is the male dominant sexual hormone, is going to be the most important in providing us the best erections and ensuring that our blood flow is adequate, that genitalia tissue is healthy. And so, we do need to consider hormonal changes if you're noticing changes in your erections. Something else regarding testosterone, if it's optimal, not only is it going to help you have longer lasting and more firm erections, it's also going to heighten your libido or sex drive. So, you're going to be more willing and interested in sex, thus creating a more satisfying experience overall.
All those things are connected.
Exactly.
So you mentioned age. How does age affect our erections?
And certainly we want to understand how is aging going to be this big problem for
Right.
us because we're all going to be aging, right? And there should be some slight decline in function as our tissues get older, we get older, but the main thing you shouldn't see is a dramatic change. This could be an underlying health condition like low testosterone, and certainly we do know age is tightly correlated with our testosterone production. But if you're noticing a dramatic change and it's impacting how satisfied you are sexually, it's certainly important to get that testosterone screened, especially as we advance age-wise.
As we learned here in previous videos, testosterone and other hormones are not always related to age.
Exactly. We do expect a slight decline as we get older, but a sharp drop off, or even those that have a substantial change and their testosterone values are not where they want them to be so they can feel fulfilled and have a satisfying sex life, it's important enough to talk to a doctor and consider getting treated so you can feel your best.
What medical conditions change erections over time?
So, chronic medical conditions that are going to impact the blood flow and the nervous system around the genitalia are going to have the most consequential response. So, we
Yes.
think of things like diabetes, which can damage both the nerves and the blood flow. We think of high blood pressure, which is going to damage the vessels, taking the blood to the genitalia, and things like high cholesterol, which can clog the arteries and make it more difficult for that blood to reach the area. So, those are the main ones, but really, there's a multitude of chronic medical conditions that can result not only in erectile dysfunction, but the medications used to treat those
Right.
symptoms and those conditions can also result in erectile dysfunction. So, making sure you are trying to stay as healthy as possible, avoid these chronic medical conditions. And if you're diagnosed with them, the majority of them are reversible. You don't want to lean on that medication for too long because then it becomes really hard to get off the medicine and to improve those medical conditions.
We always go back to having a balanced diet,
That's right.
exercise regularly. We always go back to those things because it's important to have a healthy lifestyle. That way you're preventing diseases and preventing using medications in the future.
Right. And if you get diagnosed with a chronic medical condition and you're going to be starting a new medication, talk to your doctor about the overall plan you have for this condition and this medicine. Are you going to be on it forever?
Right.
Are you going to have a plan to come off of it? Are you having a plan set forth by your provider to help you move beyond this medical condition? And a lot of patients, unfortunately, initially may bring this up, but it's hard to stay on top of it, especially when you can take a medicine that just makes the symptoms
Yes.
better and hopefully prevents it from progressing. But in general, most of these chronic medical conditions do worsen, even if you're on medicine. So trying to find a strategy to improve them from the beginning is always the best approach.
I love that you said that some of those conditions are reversible. So that means you don't have to take those medications forever.
Exactly.
When should someone talk to a doctor about their weaker erections?
And that's a great question because everyone's going to have a different idea of when it's appropriate to bring this to their
Yes.
provider's attention. For me, I always recommend you bring it up as soon as it becomes a problem for you. As soon as you notice changes or you have questions, talk to your medical professional. Some of us don't have a great relationship with them or maybe not feel comfortable in that situation. So you consider alternatives, maybe a second, physician or get a, second opinion. You can reach out to us again at hendrxhealth. We have that link in the description of this video where we'd happy to screen you and discuss these concerns. But overall, it's really when it's impacting you, you should talk to someone, sooner than later.
I feel like telemedicine helps people who have issues talking about their sexual health to their doctors.
Yeah, absolutely. Some people are a little more shy
Yes.
or maybe don't want to talk about it with their primary provider who also sees other members of their family or has
Yes.
seen them since they were a kid. And so telehealth does open an avenue where you can feel maybe a little more comfortable in your home setting and, talking to a doctor virtually so you're not so on the spotlight
Yes.
in some ways.
And so, how are erectile problems diagnosed?
So doctors are going to use various diagnostic methods. Initially, we may order a hormonal panel to see how your hormones are. In very rare cases, they may do something called a Doppler, where they'll check the blood flow to the genitalia. But in general, usually it's just a survey. It's just a conversation asking how your sex life has been, how your erections have been, and determining if they're weaker or weakening, that you may be a good candidate for medication or some sort of therapeutic intervention to get yourself feeling better and improve your sexual health.
You mentioned medication. Can we improve erections with medication?
Absolutely. So if you have low testosterone, testosterone replacement therapy is going to be really beneficial to improve your hormones and not only improve your libido or sex drive, but erection strength, firmness, and durability. And then there's also erectile dysfunction medication. So sildenafil, which is the generic version of Viagra, and then tadalafil, the generic version of Cialis. These open the blood flow to the genitalia, and so they allow the blood flow to easily enter, remain trapped in the genitalia, so you can have a longer lasting, more durable erection in that way as well. Of course, you want to talk to your doctor to determine what's most appropriate for you, but the majority of these medications have very few side effects. Everyone is different though, so you do need to have that individual conversation with your provider to see if it's appropriate for you.
I already know your answer. But are there lifestyle changes to help?
Absolutely. You can always consider exercise as a great way to increase blood flow throughout the whole body and reduce risk for high blood pressure, cardiovascular disease. And then, of course, diet. A diet high in vegetables and fruits have lots of antioxidants and vitamins that are going to keep you healthy and keep those erections strong. So consider diet and exercise always as number one if it's healthy for you. You always want to talk to your doctor about your unique experience. But I'm glad we had this conversation because
Yes.
a lot of people ask me, hey, I think my erections may be weak. I'm not really sure. I don't feel like I have severe erectile dysfunction, but there's definitely something that could be improved there.
Yeah.
And so glad we had this conversation so people out there can maybe assess their own situation and determine what's going to be best for them.
And why not have better erections, better sex, better life?
You know, better life it is. But thank you so much for tuning in for this video where we discussed erection strength. What are some other questions you'd like for us to answer? What are some other health issues or topics on your mind? Please leave them in the comments below. We'd be happy to assess those. We love hearing from you. It means the world to us. But if you haven't yet, please
subscribe, like this video, share, post, comment, do what you want. We love hearing from you, and thank you for watching. We are looking forward to see you on the next time.
Next
topic.
Next time, next week for another topic. So we look forward to seeing you then. Have a great one and see you later.
See you. Bye. Level it up
A little bit.
a little bit. It's almost like a
I know.
little bit.